Human immunodeficiency virus, acquired immunodeficiency infections or HIV/AIDS, is the virus that attacks the body's immune system. But is it right to nurture misconceptions about the virus that people living with it have no future? However, we are saying that with the right support, HIV does not have to stand in the way of achieving anything you want to do. We have this report.
The status of HIV/AIDS epidemic in the northeastern states is indeed alarming, said a report by the National AIDS Control Organization. Now the question is, why has it been so despite the many interventions made at the government and non-government at every level, spending crores of money annually? Well, world leaders have also committed to ending the epidemic by 2030. Now how close are we to that target? Dr. S.I. Ahmad explains.
This is a concern globally, not only of India, but the entire world. If you look at the UNAIDS data, all the goods that we have, all the evidence shows that all the good results that over the last 4 decades that we have achieved of the slowing down the epidemic of HIV/AIDS. But in the last 2 years, all these achievements have been slowly being neutralized because of COVID. COVID has changed the entire scenario. Now we are trying to find out, because you see in the UN sustainable goals that we have set, and even for the control of HIV/AIDS, we have set that we will eliminate the entire epidemic or control it to the maximum by 2030. But this 2030 goal was actually a very set goal which was achievable about 3 years back. But you have seen what has happened in the last 2 years.
The onset of COVID-19 has undoubtedly impacted the fight against HIV/AIDS, with accessibility being a major concern.
We had been trying our level best to fight against this illness and to control it. The government, right from the Ministry of Health and Family Welfare, Government of India, to the National AIDS Control Organization, has been trying its level best. And in the state level, we have the State AIDS Control Society, which is a part and parcel of the government in combating this illness. The program has been going on, but during the last 1.5 years, since COVID-19 came, the program has really suffered a setback. There has been a decline in the number of patients coming to our service centers, though now that the situation is slowly turning back to normal, it is picking up again.
Each hour, nearly 140 people die from AIDS-related causes. There are nearly 37 million people living with the disease, and there were 2 million new infections reported in 2014. In India, the AIDS-related mortality per 1 lakh population has been estimated to be the highest in Manipur, followed by Mizoram, Nagaland, Andhra Pradesh, Puducherry, Meghalaya, and Telangana.
In Manipur, the problem of drug use and HIV/AIDS was actually started from 1990 onwards. The first HIV case was detected in 1990, and the intervention program among the drug users was started from 1998 onwards. As you know, Manipur, when we say about drug, then the same people who are infected was very high in 1997. Among the drug users, HIV positivity rate was as high as 76%. So people thought that once if a person got drug addicted, then people assume that they are also HIV positive. Like that, with this notion, many of the drug users were discriminated, and many of these drug users try to hide, try to go underground. That's why the spread of HIV was very fast at that time because of this, due to the stigma attached to them and due to the fear of their exposing their identity. That's why that was the main cause in Manipur for the HIV higher rate.
Despite the fact that HIV/AIDS knows no boundaries, stigma, discrimination, and miscommunications are some of the challenges faced by people living with the virus. Now, these are valid issues that cannot be brushed under the carpet.
The reason being is, again, I would say stigma, okay, where they would not, they have fear, the fear should, in the people to come forward for testing, the fear that people, what will people think if I do the HIV testing, the fear that what will my wife do or my husband do if they know that I am positive, you know. So because most of the women, I would say, they live in a that fear where people would chase them out of the house, would discriminate them, you know, would ostracize them, where it has often happened also, where a person living with HIV has been ostracized, has been discriminated in the locality, or be it in their own family itself. They won't accept them. They think that HIV is whoever gets HIV, it's a big sin.
It just being positive doesn't mean that you need to you can lead a productive life. There are many people living 35, 40 years with HIV having antiretroviral therapy. Because just having HIV doesn't mean it's the end of life. You can live a very productive life. See, people live with hypertension and diabetes for such a long time. The day I got into the medical college, I was diagnosed as hypertensive. I was 16, 18 years of age, and still now I'm on antihypertensive drugs. You can live with anything, but provided you take care of yourself.
The issues at hand are immense and needs immediate attention and intervention. And our borders are posing a massive challenge towards realizing that goal.
Due to the situation of our state being in the transit point of this international drug route, and our borders are not properly fenced, and many of the drug traffickers are passing through our national highways, and that's why many of the young users still coming up.
A pertinent question arises. How then can the government, the non-governmental organizations, and the community at large come together to address the issue?
Regarding the role of the government, yes, the government has been playing a part, but we still have to do a lot. And what we really need right now, according to my personal opinion, is that we need to again go for an aggressive campaign right to the grassroots level of the community regarding the modes of transmission of HIV, again the importance of early testing and the importance of adherence to treatment.
See, when you talk about NGOs playing a major role, yes, we do play, NGOs working in the field, they have more experience, they are more exposed, meeting with the marginalized, especially when it comes to the marginalized group of people, be it female sex workers or MSM transgenders, injecting drug users or so, then because they have a certain target to achieve, they are more, the marginalized group of people are more open to the people of NGOs who are working in the field, and it's more, they work as a bridge for between the community people, the general community people, and also the marginalized group of people. So yeah, when you look at it, the NGOs play a major role here, because without the NGOs, the marginalized group of people would have nowhere to face to talk to, and it's easier for the NGOs people to go and mobilize or to talk to the people living with HIV, or to motivate them, or to do the counseling or the pre-test or the post-test counseling for HIV or STIs.
There are misconceptions surrounding HIV/AIDS which are misleading, thereby giving rise to unwarranted treatment against people living with the virus. Weeding out misconceptions would bring about that much needed behavioral change.
HIV infection spreads only through 4 modes. Number 1 is through sexual transmission. Number 2 is sharing of infected needles, which is more so in the case of intravenous drug users. Number 3 is infected blood and blood products. And number 4 is from a mother who is infected with HIV to her unborn child, either during pregnancy or even through or during delivery or breastfeeding.
For a mosquito to transmit HIV, it's near to impossible, because like now HIV mosquitoes, they don't, they just suck the blood, and then like in the mosquito, they also have their own gastrointestinal fluid, like which can kill the HIV virus also, and that's the reason why mosquito cannot transmit from one person to another person, especially HIV.
As AIDS has no cure, it is but imperative that utmost thrust is given to plug the gap and help curb the rise of HIV/AIDS across the region.
Let us start with the state government first, and let's have a Northeastern Council involved with all the states involved. Let's have a task force. Let's control the drug supply, and let's have good rehab centers. Let's treat the issues of women, those who are having STDs. And a lot of women who are pregnant with HIV have started mother-to-child transmission prevention, so we can start those antiretroviral therapy. And accessibility of drugs. There are people who are already, you see, more than about 5,000 people, I think they are accessing antiretroviral drugs. So we must ensure that the districts have those stock and accessibility is there. They're given some kind of a pass or something so that they can come during the curfew also, they can come and collect them. So these kind of confidentiality has to be maintained after all, because there are a lot of stigma still. And we have to energize the entire system in the rural areas also through the health centers that we have, because that's the only massive awareness programs with support from treatment for STDs, support for rehab for drug users, supply line, and the demand reduction and harm reduction programs.
Well, a ray of hope may not be too far away if we emphasize on massive awareness programs and energize the entire system involving every stakeholder. With inputs from Roger Sangma in Shillong, Sarah Konyak in Kohima, and Gautam Sharma in Imphal, this is Aaron Lingdo for Northeast Live.